think it at all levels, it still requires, and I think it will require for a very long time, human involvement. I don't think it is, ready to be able to make all decisions. Let's say a patient coming in at a radiology receptionist, and want to get it done. It's still, yes, AI can probably do the intake, a lot of the parameters and everything, but to be able to greet somebody and to be able to check all the information and make sure that a correct test is being done and at a correct part of the, I should say correct modality, that's one thing. And then the technologist who is going to take the image or do a full study on it also needs the help of AI to keep the information streamlined, but to be able to make a proper judgment, which particular sequence in MRI need to be taken and what part. Not everybody's kidney is sitting in the same anatomic position. If the kidney is located all the way down in the pelvis, then the human involvement is needed for them to be able to switch the parameters in a certain way and move the field of view a little bit down so they can include that, right? So those are the kind of things. And there are many different variations, not only anatomically, but physiologically. Somebody with a low blood pressure or somebody, may need a different timing of bolus compared to somebody who's hypertensive. So those are all the decisions. And even at a human interpretation level, yes, AI may be able to triage a lot of these cases. But what does a particular opacity in a lung, even a case of a trauma, really means? Unless you know that, patient also has a history of some sort of atypical pneumonitis far back, and then suddenly your interpretation changes. And if you don't have that information, and even if you have that information, but somebody didn't put it together, then the results could be, drastically different and may not serve the patient correctly and appropriately in a particular time.